Can you speak again, please?
Can you just say your name and your affiliation so that we can hear clearly?
Okay, yeah. My name is Monica Punjabi Verma. I'm the president of Indian Sign Language Interpreters Association. So we are
Yeah,
the professional sign language interpreters, Indian Sign
sure,
Language.
sure. And so you will keep your line on mute. Thank you so much.
Sir, so
Yeah,
Miss Monica will be there online, but she will not be the part of the discussion. She'll just
fair
do the
enough.
information for.
Yeah, and it's coming onto the Facebook site. Great.
Yes, sir.
Thank you so much. We are at 3 o'clock. Are we ready? Is Dr. Adarsh here?
Yes, sir.
Yes, I am here.
Thank you.
Okay.
We can hear you clearly. Yes, we can see you. Thank
Okay.
you so much. Yes. Is there another iPhone that's connecting in? Do we know who's?
I can hear you very well.
Yes. Thank you, ma'am.
Yeah.
Adarsh, ma'am, can you just mute your line, please? Yes. Thank you so much. Thank you. Right. Okay. It's 3 o'clock. IHW team, are we ready to go?
Hello.
Yes, sir. Good to go.
Good to go.
Yeah.
Dr. Sandeep?
Yeah, hello.
Yes.
Hello.
Thanks. Yes, you're very clear. Can you just mute your line, please? Thank you so much.
Yeah.
Thank you. Thank you. Right. Live? Imani?
Yes, sir.
Live?
Yes, sir.
Thank you. Good afternoon, everyone. Thank you for joining the IHW Council on yet another webinar during coronavirus times. Life has to carry on, whether there's a pandemic or not. And what better way to think about life and its carrying on than to have a discussion with a panel of very senior obstetricians and gynecologists who do not have a day off, whether there's a pandemic or not. In fact, we have people who have just stepped out of the labor rooms. We have people who are constantly on call, responding to the cycle of life. There are nearly 25 million children that get born every year in India. And it is our obstetricians, gynecologists, frontline midwives, labor room workers, technicians who keep this natural flow of life going, irrespective of what is happening around us. These are not easy days, especially when everybody is told to stay inside, take care so that they are not affected by COVID. And yet, you cannot prevent a child whose time has come to arrive. A mother, a pregnant woman who needs care needs to be given it at the right time, at the best quality possible. And so, therefore, it is our privilege to bring to you a panel of distinguished, eminent, experienced obstetricians and gynecologists who will not only talk to us about what we need to do during these times, specifically as we await the arrival of an expected child. It's supposed to be a happy time. And what are the concerns? What are the things that are worrying you that they may be able to answer? We are also, as part of IHW, very privileged today to have the Indian Sign Language people join us. We recognize that our conversations are not always accessible to those with hearing impairments. And so therefore, thank you so much for the ISL team and Monica specifically to be able to join us and be able to communicate to a wider audience. To those of you that are joining us on Facebook Live, thank you for being with us. This is not going to be a conversation between the experts here. This is a conversation that is being put together so that you are better informed and where you can ask your questions. So keep your questions coming along. My name is Bobby John, and it is my privilege to host this conversation for the next nearly 90 minutes or so. Every 15 minutes or so, I will summarize the conversation so that we have a capsule as we go along. The difference between a virtual conference and a physical one is our panelists remain with us all the time. And so it's sometimes tricky, but we have this conversation meandering through. And so thank you very much for playing along with the new rules of virtual conversations. Let me start with Dr. Hema. These are interesting times. These are difficult times. These are challenging times. And you, not only do you run a hospital in Bangalore, not only are you looking after obstetrics and leading up the work there, but you also have something called Artist, that is the board behind you. Tell us, what is Artist and what is obstetrics and what is the current situation all coming together and looking like for our people? Let me start with you.
Yeah, thank you, Bobby, and hello and welcome to everyone. Artist, as it expands, Asian Research and Training Institute for Skill Transfer. This is really the time of need where we have to transfer the skills of readiness to handle the patients in the backdrop of the corona crisis, which means that your hospital needs to be COVID friendly. And how do you make that? How do you ensure that every patient comes in there, is triaged, and every patient is sitting at least a meter away from the other patient? Everybody is hand sanitized repeatedly. Both the caregivers and the caretakers are, in sync with the principles of what needs to be done and do's and don'ts to be meticulously followed. So that is essentially the strength of Artists, the capacity building or the skill transfer of the entire strata of healthcare providers. Again, with the digital connect, we have broken all the geographies and we want to make history to make everybody competent to deal with this new way of tackling with the patients, inclusive of the digital and the telehealth modality. And the research, you know that this whole issue of COVID is only few months old. There's a lot of data that needs to be documented. And as we go along, we have to learn our lessons and update. So what is the perspective? What is happening in the Indian scenario? What do people in the country think? And what do we as healthcare providers think? That is the mix of the data that we are gathering to have the trends and our thoughts steer ahead in a way that we learn our lessons and do better and better for our country and Asia. So that, Bobby, is Asian Research and Training Institute for Skill Transfer.
Thank you so much. I will just pick up the skill transfer bit and amplify on it, because that is essentially the core reason why these webinars are being done. Skill transfers, very rightly for in the healthcare setting, is to be between those within the healthcare delivery chain. But there is also a skill transfer that's required to those that are at home, because it's not always that people can come in, and the frequency of visits are also not as feasible as it was before. And so therefore, there needs to be a necessary skill transfer outside of the hospital into the homes and into the community. And this probably is also a very interesting opportunity. This is probably the one time that this conversation can be inclusive of a large number of people. The entire family or the community also gets involved. And how do they kind of support the journey of a pregnant woman and into the early days of a child's life? And that becomes part of raising up a child that takes a village. And so therefore, let me kind of then move on to Dr. Alka Kriplani. If the skill transfer is what we are talking about and needs to move to the home level, what is your first bit of advice to those that are expecting their baby? Ma'am, you're on mute. Yes, please go ahead.
So usually what happens that our patients come to us in the hospital and we care for them. Now with this corona thing, we want our patient to stay at home. So we have to use more and more of, like we are doing now, the telecommunication, the video conferencing, and things like that. So the digital India, that is the motto also, I think it is an opportunity that in far-flung remote areas we will able to, because we are able to connect to maximum people. This may be a way forward for the future, that more and more patients are contacted at their homes by all these digital media and things available, video conferencing, telephonic, and that is what we are doing now, because we don't want them to come again and again in this COVID atmosphere. So we are contacting them, and especially WhatsApp groups. So all these medias are very playing a very important role in our antenatal care and providing our patients all the information, do's and don'ts, when should they come, what is the must to come, and when not to come unnecessarily.
Thank you so much. That becomes a opportunity to deepen the connect or broaden the connect. But what would be the top advice today that you would give Dr. Adarsh? And I know that you will be here only for the first half of the program. If in these times, in Corona times, when we are not encouraging people to come as often as they should, we have a schedule. People should come in the first trimester, then in the second trimester, and the third trimester, the schedules change. But now with Corona, you're saying don't come as often as you were supposed to. What is the top set of advice that you would be giving?
My message to all the pregnant ladies is that they should not be panic, but they should be careful. Now, careful about what? That has to be communicated to them. We can communicate it by any digital means, as Dr. Kripalani was telling us. But otherwise also, when they are telephoning us or they are giving a WhatsApp call, we can tell them what is being done today, that is social distancing. Even in the house, they should not be sitting together very close. They should be at a distance that they should be sitting. Then they should wash their hands frequently with soap and water up to the elbow. And then if there has got any respiratory problem or any fever, any cough or fatigue, or if they are feeling not good, they should go to the doctor and get them checked up. For the respiratory cleansing, we advise usually to have gargles twice or thrice a day with salt or with some small amount of betadine in it. Then they should take warm water, not cold water. Then when to visit, which you are telling me, usually the routine is different for first trimester, second trimester, and third trimester. But in these days, we advise them to have a contact with the doctor between 11 and 13 weeks, so that important tests are being done at that time, which are very essential for the future baby. Then second should be around 18 to 20 weeks, when all anomaly scan and any other test which we need. Vaccinations are to be done in time, which we always give them in writing, or we can inform them also. And till 32 weeks, if they have any problem, they can come to the doctor. Otherwise, they can stay at home, take a balanced diet, maintain all these precautions which I have already mentioned, and they should note the movement of the baby. The rule of 10, which can be easily remembered by the woman, is 10 a.m. to 10 p.m. there should be 10 movements. This is a rough estimate. Otherwise, we were telling the patients that 2 movements per hour is a must. But then you have to take a left lateral position and note for 1 hour after a few hours. But that is a cumbersome process.
Right.
And after 32 weeks, they should come to the doctor frequently if they need. Otherwise, not. They should stay at home. But after 37 or 38 weeks, they should wait. Once they should have a checkup and then wait for the normal pains or any other problem to start and then visit the doctor. We should not hurry.
I'll just hold you there, because there's a lot that you have said. I want to kind of paraphrase for our audience also, and just take the big message, because otherwise it becomes difficult. First and foremost, Dr. Adarsh is saying, do not panic. There is no reason for you to panic because that causes more problems than solves anything. Exercise care and be as calm as life allows you to be. Um, and part of that is our advice that keeps going every time that we have such a conversation. Just be careful as to the kinds of information that you're taking in. Not everything that comes from WhatsApp, not everything that comes on social media is useful information. The best information that you'll get is coming from your doctor whom you have been seeing or whom you are going to be seeing, and please rely on that. Do not fall prey to all kinds of advice that comes, and there'll be no dearth of advice. So first things foremost, do not panic. Do not be taken in by any kind of messages. Wash hands up to the elbow is what ma'am is saying, and that will be a good hygienic practice. It keeps you safe. It enables you if you're taking care of family members also, because that part of life also is happening. You are enabled, you're being safe, and you're keeping others also safe. My question, because this is normal work, normal practice, we encourage people during their pregnancies to also get some mild to moderate exercise. And so, Dr. Jayashree, if I may ask you, while we're saying do not panic, be calm, wash hands, keep adequate distance, what about exercise? Isn't this something that we tell people normally, get a little bit of walk and stuff like that? These are days when everybody is saying, hey, you're going out for a walk, you're putting others at risk. What is your advice? Because this kind of can raise panic and anxiety in our audience.
It's a very relevant and pertinent question, and this is something we face from patients when they come for their tele-consultation with us. The thing that I tell them is the steps can be done at home also. It is not mandatory that you need to step out of your house. You can do it in your corridor, you can do it between rooms, you can do it in your terrace. You don't necessarily need to be outside of your house. And nowadays, everybody has an app, right? So they always keep counting the steps that they have done. So that also gives a positive feel. Oh, I have done 10,000 steps today. So it is not mandatory that you need to be out of the house. And yoga is something that can be practiced sitting at home. You just need a mattress and a floor to sit on, and you can practice your yoga. We are also trying to encourage girls to follow the yoga, and the most relevant thing that I have seen is I don't people are forced to work at home nowadays because there are no takeaways. I'm very thankful for that, because nobody calls that they have a tummy upset because they're all eating homemade food, and they are made to work at home because there's a dearth of maids at home. So everybody is already baking their back, and fantastically nobody is gaining much weight in the 3 weeks that they have had their antenatal checkups or when they call from home. So there are many things that can be done just sitting at home. It is not mandatory to be out of home to be exercising.
Thank you so much, because I mean, you're seeing a silver lining here, which is that now that people are working, whether they like it or not, there is a moderate amount of exercise that's already happening. And so if we can bolster that, that is actually helpful. And if we can adopt yoga or other exercises as recommended by your care provider, then that would be actually helpful in both maintaining your health and also allowing you to prepare for the oncoming labor shortly, whenever that starts off. May I then switch to Dr. Amrita Shah. In the process, especially in the earliest days, I mean, the early part of pregnancy, first time, or those that are planning or happen to now suspect that they've got a pregnancy going. Normally, it's given 10, 12 weeks, people kind of begin to wonder, where's my period? Is there something that they can do other than just the tests at home? What is it that they need to be reassured about? And is there a place where they could be missing something else for the irregularity in their periods?
So supposing somebody has missed a period, then obviously the first thing that comes to their mind, if they have been planning their pregnancy, is that it is a pregnancy. Then I would usually tell these patients to, stay at home and just hold on for at least 10 weeks before either they will get the periods if they are not pregnant, and they will not get the periods if they are pregnant. So then normally we would tell them to come to the hospital around 8 weeks and get an ultrasound done. But for these patients, I would tell them to come only after around 10 weeks, 11 weeks to 12 weeks, and then get an ultrasound done. So that is the time when I tell my patients that you get an ultrasound done in the hospital, and during the same visit, you come and visit me so that the required tests can be done. So that is usually the advice I give them. And I also tell them that, they can start with folic acid, which once in a day they should be taking, along with taking, good amount of diet. And supposing if they are feeling nausea, vomiting, obviously they can do a teleconsultation with us, and then we advise them accordingly.
So if I may summarize that very quickly for the audience, if you have missed your period, if you were hoping that you would be pregnant, continue on, wait, no harm done. And at 10 weeks or thereabouts, you could reach out to your doctor, to your institution for your first set of checkups and ultrasounds. If you were not, you can still hold on. But in either case, it does you no harm to start taking, or if you're already on folic acid, to continue on. It is something that is not going to do you harm. On the contrary, it does you only some good. And so therefore you can continue on. It doesn't really bother you. What you should not do is cut down on your food intake, because that is not helpful at that point in time. And I know these are difficult times to get the right kind of foodstuffs coming into the homes, but whatever it is possible, just make sure that you're eating well and adequately and staying well hydrated. If now then the question comes, they have to, or individuals, husbands, wives have to kind of come to the hospital. How does one convince the police? How does one convince the emergency nature of your visit to the hospital? This is something that's becoming incredibly interesting, especially in the hotspot districts. And I could ask Dr. Sandeep, because you're based in Noida, and this is where something is happening right now, where there are many parts of Noida that are considered hotspots. How do early pregnancies or people within their first 10 weeks convince both their neighbors and the police that they need to get to the hospital? And what's your advice that we may amplify?
See, as it was said earlier, there's no need to visit till the first 11 weeks. It's only at 11 to 13 weeks that we do a NDNB scan, a dual screen, and the patient ought to come to the hospital. Before that, video conferencing can be done. The patient can send us the reports on WhatsApp, and we can see and advise them accordingly, the medicines. But during the later trimester, obviously the woman looks pregnant, so the police don't stop these people. But yes, in between the 11 to 13 weeks and the 18 to 22 week scan, it is generally they have some kind of a prescription, where in Noida, the police is not stopping these people. If we've told them that the patient needs to come to the hospital, and we are only doing the visits.
We've lost you there. So maybe I can just come to Dr. Payal, because Dr. Payal, I mean, this is the domain of telehealth, right? I mean, so that's why I mean, there's a way that I've been kind of getting this conversation so that I can come to you. Early on when you're not appearing pregnant, is it possible for people to get a tele prescription or a tele advice that says, and it's validated, that you can actually go to the hospital? Where does telehealth come in this whole thing?
Yes. Nowadays, the most in thing is telemedicine. any patient anywhere in the village, anywhere in the city or at home, you can always consult your doctor through telemedicine. And Apollo, I'm from Apollo, and Apollo is having a very big system behind this telemedicine. We have a inbuilt online prescription which we prescribe after speaking to the patient, after doing all the examinations or whatever investigations needed. We have all the format that we have investigations, we have prescription, and we give online prescriptions to the patient that they can show to the police officers, because at such early times, at 11 weeks, 10 weeks, the patient doesn't look pregnant, but still they can show the online prescription, they can speak to the doctor, and I think the police will allow them after seeing that prescription, because it is having a digital signature of a doctor, it is having the registration number of the doctor. So definitely I think the police will allow them to go to the hospital in case if they want to go for a checkup, for whatever reasons, if they want to go, because
Right.
and we mention in our advice as well ki, they have to report to the center. It is very important, it is mandatory, everything is reported in that online prescription.
Right. Thank you. I mean, this is where I want to kind of turn to Dr. Alka Kriplani and to Dr. Adarsh, both of you. People will, if it's a planned pregnancy, if it is something that people have been expecting, there is one way to go. There are a very small set of people who've been actively working towards getting pregnant. Those that have been on certain kinds of treatments or on IVF cycles, those are a special subset of people for whom they need to be in touch. They need to be coming back. I mean, for that small subset of people, what's your advice, both of you, Dr. Alka and then Dr. Adarsh? Yes, ma'am. Go ahead.
For infertility, no active treatment in this chaotic time. So all those IVF cycles which were in their way, we advise that they should be having, frozen gametes, and no active treatment, no calling for repeated ultrasound, no follicle monitoring, no drug intaking, because they will end up in hyperstimulation. So for the time being, active management of infertility is a no-no. I just raise my hand to add to a point by Dr. Payal. The simplest thing we people are doing is sending a WhatsApp to our patient and giving her that you are pregnant, you are supposed to see me at Paras Hospital this time. And I tell them, if anybody stops you, show that WhatsApp. And that is working very well in Gurgaon.
Thank you so much, ma'am. Thank you so much for saying that. Dr. Adarsh, before I kind of summarize what Dr. Alka also said.
Actually, I agree with Dr. Alka Kriplani has told just now. And the question comes when the patient has already become pregnant. So we are not to worry, because the IVF person has already done the test and they have confirmed the pregnancy. So now they will be treated as a normal pregnancy, as we have been treating the spontaneously pregnant patients. So again, we will need them at 11 to 13 weeks. And and WhatsApp prescription, as just told, is working here also in Jaipur.
So just to kind of summarize, if you've been on an IVF cycle, or if you've been kind of working with your gynecologist on fertility-related issues, the advice is right now to hold off on any further active engagement intervention. And you can kind of come back to it a little bit later. If a pregnancy is confirmed, then you're on your way. The same advice that's been given earlier applies. No panic. Just make sure that you are not in situations of risk. Wash hands adequately, eat well, sleep well, get as much exercise as you can within the confines of your home or your surroundings without putting yourself to risk, and you should be fine. When you need to get to your doctor, either a WhatsApp prescription or a telehealth prescription that's digitally verifiable is good enough for you to get to your care provider so that you can get your first set of interventions. In between, if you need your folic acid, and if you think that you should have been on folic acid before, just go ahead and call your nearest pharmacy and make sure that you have got adequate supplies of it. And that kind of gets us over the first 3 months of the whole journey of the pregnancy.
Bobby,
Dr.
can
Hema.
I just speak
Yes,
one
Dr. Hema.
concluding sentence for the first trimester sum up? Okay, while the experts have given the advice that even if it is 10 long weeks you haven't had your periods and you're hoping for a pregnancy and waiting on, most women, both in the metros and the second, third tier cities as well, know with the Bollywood stars, with the photographs there, that you can detect your pregnancy with the urine pregnancy check in just 5 minutes flat. So they can figure out if the pregnancy is there or not. That's point number one. The second point is that if they had any untoward symptoms like very severe pain and bleeding, even during the first trimester, it is an emergency and essential services are allowed as on today. And tubal pregnancies or ectopic pregnancies can be life threatening. So they must show the WhatsApp, as Alkaji said and others she said, and they must visit their doctor, because just one odd one out of many, many pregnancies may have this issue. And please do not stay quietly at home in the hope that everything will be well. If you have unusual symptoms other than the usual vomiting, giddiness, excess sleep, tiredness, etc., that's okay. But that is why the video call or the chat option with the doctor is important, because you please let her know your symptom. She will tell you that you need to visit me immediately, and then you please go ahead and she'll do the needful. Yeah?
Thank you so much, Dr. Hema, for pointing out that exceptional circumstance. If there is bleed, if there is pain, those are not features of a normal early stage pregnancy. You need to be seen by somebody qualified. Do not try doing stuff at home. It needs to be seen by your specialist. Make sure that you get in time, because if it's particularly something that you and your husband were planning for, if this was something that was being expected, you don't want more trouble than where you are at that particular moment. Let me flip to the other end, completely the other side. A baby is born. I mean, the labor pains have started. You manage to get to the hospital. The baby has been delivered safely, successfully. Both are healthy. As just Dr. Jayashree, I mean, she's just come out of the delivery room too. What's your advice on breastfeeding, especially for first breastfeeding and then breastfeeding in these COVID times? I mean, particularly with potentials for exposure and stuff like that. What would be it? And this is a question that's coming in from the Facebook audience too. Dr. Jayashree, on breastfeeding.
So, breastfeeding for all patients, absolutely mandatory. We encourage them to start feeding from the time they have started delivering. In fact, we are encouraging for crawling of the baby on the mother, and breast crawl we have started, and we encourage, whether it is a normal delivery or a C-section, we encourage all of them to have breastfeeding. And in fact, we take antenatal classes so that give them the positive effects of breastfeeding. In the COVID scenario, thankfully till now, we have not delivered any COVID positive patient as such. But even in the COVID scenario, even from stalwarts, from AIMS and everywhere, they are saying that we should encourage breastfeeding in this scenario, because it is not transmitted through breast milk. So the safety measures have to be taken. The woman should be wearing a mask. She should be scrubbing her hands. But breastfeeding should be encouraged wherever possible. And there is no contraindication to breastfeeding, even if it is a COVID positive mother, unless she is very sick, which has not been seen in any of the COVID positive patients.
Thank you, ma'am. Dr. Adarsh.
Actually, I want to add here that if the patient is suspected COVID or she is COVID, then we have to give her expressed milk to the baby. Not direct feeding should not be done, because even if a mask, the baby can be infected. We should have a screen, a cover to cover the baby, so that the mother's breath is not going towards the baby. So these are the precautions which are to be taken in a suspected COVID or a COVID patient.
Right, Dr. Alka?
Audience should not be confused. Somebody saying yes, somebody saying no. We have to have a balanced view of the situation. See, why we say that the breastfeeding should continue? Because we know on the top feeding harms are more. Like they may not be able to maintain hygiene and baby may not die of the infection. So for very affording patients, ideally, we say that there should be segregation. So if possible, It is a good way that the baby for 14 days, if kept out, then the baby will be very safe, because when we are giving to the mother and she is a COVID positive, then there is high chance of transmitting the infection, and she has to take lot of precaution that baby does not get these fomites. By and large, but seeing the situation in countries like so it is advocated, like it happened in HIV thing, that you should allow, because it doesn't excrete in the breast milk, all proper precautions can be taken, then breast milk by and large is allowed, thinking that the separating the baby, the happy compromise is express breast milk and somebody can give it, because it is not in the breast milk, it is during the contact while feeding. So more and more use of breast pump, express breast milk, and 14 days either quarantine or be very, very careful so that baby doesn't become positive.
Thank you, all three of you, because and that's a little bit of the technical conversation that took place. And as I turn around, I'm going to put on my own clinician hat too. Once upon a time, I used to deliver babies. Once upon a time, I also used to look after people with HIV, especially women, and I used to run a care center there. And the experiences on both sides have kind of told us that the breast milk is the best as far as the baby is concerned. It is the best vaccine, the first vaccine that the baby is going to get. And so therefore, enabling and encouraging safe breastfeeding, early breastfeeding is paramount. The only exception where there may be a place for, let's put it this way, a little bit more of care would be a COVID-19 positive patient who we know as confirmed has delivered, in which case I would suggest that the advice would be entirely at the level of the person who's taking care of you. And they may vary from center to center, they may vary from patient to patient, the circumstances will be different. And so therefore, I would avoid giving blanket advice to those who might deliver a baby while they are COVID positive. The earliest series results from other countries that we are seeing is that COVID positive pregnant women coming into delivery are by and large asymptomatic. And so, given that we are not testing as many people, there may be a question around us that will entirely depend on the advice that will come from your obstetrician. Please take care of that. But for the rest of you who are delivering a baby in these times and you are not sick, you're not obviously sick or tested or have a contact, there is no reason to abstain from early universal breastfeeding. That's the best gift that you can give the child, and please continue to do so. Do not go by anything other than your directed advice that you might get specifically. The broadest advice for everyone: life continues as normal. I know that Dr. Adarsh has her finger up, and I know that she's also on a time. So I'll just give it to her before coming to Dr. Amita. Dr. Adarsh.
Yes. The question was not clear because the voice was
So
not.
I just saw your finger. That's why I kind of came back to you. But I just wanted to summarize for everybody that that's where we are. So when it comes to a baby having been born, breastfeeding is universal, and if there are exceptions, it is entirely up to your your obstetrician and your pediatrician, neonatologist who's taking care of the baby, and those are going to be only specific to you, not broad advice. There is a question, and this is where I kind of want to turn around. I think it's been answered, but because it's come through Facebook once again, I'm going to ask this. Is ultrasound scanning routinely required, or can they be spread out? And let me ask Dr. Amita Shah here. Ma'am, we can't hear you. Yes.
Yeah. So ultrasound can be definitely spread out. Normally, we would get, mandatorily around 5 ultrasounds. One is a dating scan, which in these circumstances, we would not be doing. We would want our patients to come at between 11 to 13 weeks, as has been said previously, and get a level 1 scan. If that also cannot be done, supposing somebody cannot travel or is in a hotspot area, then mandatorily we would want the patient to do a level 2 scan, which is between 18 to 20 weeks. So that is one important scan which we would like for our patients patients because we rule out all kinds of anomalies in that. After that, maybe we can again skip the growth scan, which is done around 28 weeks. And then we can straight away go into a Doppler scan, which is around 34 weeks. So
for the level 2 scan and for the Dopplers. That cannot be done there.
Sure. So ultrasounds, you need to go to the doctor, but the immunization could be done at a subcenter or at something that is not quite near the hospital, somewhere closer to you. I just need to take a pause for a minute. I think I've been told that there is a technical difficulty on the line. Just hold on, Dr. Adarsh, I will come back to you. Dr. Alka, I've seen your hand. Just hold on for a second. We are paused.
जल्दी कनेक्ट करो, पॉज आ रहा है क्या
Post. Are we good to go? Money. Right. Himani, we're starting off back.
Give me 2 minutes, sir. I'll just give you a heads up.
Sure.
See me online. Hello? Hello? Yes?
It looks like there is a feed issue on the Facebook Live side. That's what the update is. This is for the panel. This is not going live right now. That's why I had to stop. Thank you so much for waiting. Sometimes these are the glitches that happen with technology. There are further questions coming along on gestational diabetes, building up immunity during the COVID times. Right, we are back on live. Thank you so much. Sorry for the brief interruption that we had, we are also learning how technology can sometimes keep everything at abeyance because a single line got shut down. Welcome back to our IHW special conversation on pregnancy during COVID times and how we kind of allow for the normal cycle of life to continue while dealing with pandemic situations. And therefore, we kind of come back to just summarizing, because we've had a little bit of a break. Just the first bit is pregnancy during COVID times is not a cause for panic. Remain calm, exercise due precautions, stay far away from situations that put you at risk. Don't get into crowded situations. Stay away from people with respiratory illnesses or cold, cough, flu, all of that. Wash your hands religiously, all the way up to the elbow is what the recommendation has been. But make sure that you do so. If you have a difficulty and you're in your early stages of pregnancy, that should not be an excuse for you not going to the hospital. Ensure that you seek care. If there's pain or if there's bleeding, that should not be there should not be any reasons for you not to seek the care. And the other bit that we talked about was breastfeeding can continue for every child. It is their right and it's their first vaccine, and that should not be withheld from any child. Coming back, and this is where a question has come up from the audience. We are in our stages of pregnancy. We are into our late second trimester. What about diabetes? I had been diagnosed earlier on that I had gestational diabetes. What do I do? Let me start with Dr. Hema here.
Yeah, these are the typical situations where we label them as high risk pregnancy because there is a comorbidity. There's something additional happening to your pregnancy, as in the normal pregnancy is now spiced with high blood sugars. Well, it depends on the early pregnancy test, whether it's shown you high blood sugar or in the mid pregnancy. And at that start point, your doctor would have definitely given you the first line of advice on diet and exercise, and would have asked you to repeatedly monitor your sugars at home with a glucometer, which you must do. And you must get in touch on a chat mode or a telecall or a video call or whatever, and be in touch with your doctor. Because if the sugar is not meeting the targets and it is uncontrolled, then she will have to necessarily add on the next prong, that is an oral tablet to get the sugars under control. And these are typically the pregnancy which cannot stick to the far and few in between schedules, because there are many things that we need to monitor for the mother as well as the baby. So your advice by your individual sugar levels being controlled or not controlled, and what your doctor says. So please be in touch with her very, very frequently on the telecall, and at the appropriate times, more than usual. Of the 3 visits or 4 visits, she's definitely going to call you back depending on how you're doing. And again, as Alkaji said, don't panic. This is a problem, but this is a problem where you can control it with diet, exercise, medication, worst coming to worst, insulin. But as long as you maintain the target level of sugars, you and your baby will have a good outcome. Last thing I want to say about gestational diabetes. Anybody who is having a high sugar or high blood pressure in pregnancy, in this era, backdrop of the COVID, are all the more vulnerable and susceptible to the COVID infection. So please, we urge you, like the little children and the elderly, the pregnancy, especially the pregnancy with these risk factors, have to be very, very cautious on following all the regular do's and don'ts of distancing, hand sanitization, etc., 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 very, very meticulously and very disciplined way, not only your sugars, but also all of these, so that you should not be the one at-risk person getting to be highly suspect or COVID positive. We do not wish you should get into that bracket. So prevention is always the mantra for the women with gestational diabetes.
Gee, thank you so much. I mean, so the advice is, if there was a indication that you had a deranged blood sugar level, whether it was the first trimester or the second trimester, for you, your care package becomes very individualized, and it will be constant communication with your care provider. You cannot take the easier, expanded, we can have lesser numbers of encounters at the hospital or engagements with our gynecologists. You have a specialized schedule. Let me ask the corollary. People may not discover that they have got uh, gestational diabetes, but there may be a set of people who might basically say, my feet are swelling up, or I can feel that my hands are getting a little bit more tighter, the ring is getting tighter, and things like that. What do we advise such people? Dr. Amita, if I can start with you on that. Ma'am, I can't hear you. Dr. Adarsh, go ahead.
Yeah, I'm very thankful to you for allowing me to have this discussion with you, but I have to leave. That's why I'm taking leave of you. I'm thankful to everybody. Thank you,
Dr. Adarsh. Thank you so much for your time that you were able to kind of spend with us.
No,
Thank you
I
so
have
much.
that OT table has been allotted, so I'm going there.
No,
Thank you.
Life has to continue on, and that's where our
Thank you.
obstetricians, that's where our
I will be
gynecologists.
I will be missing this important discussion, but what can I do?
No, not a problem
Thank
at all.
you. Thank you.
And for those of you that are watching us on Facebook, this is something that is that we all need to pay attention to and acknowledge, that our doctors, that our healthcare workers, they are on call, they are coming, their schedule has not changed, will not change, in fact becomes even more difficult during these pandemic times, and therefore even more necessary that we are mindful of their circumstances. Please do not harass them when they're coming or going. They are not deliberately putting anybody to harm. In fact, they are the ones that we need as fully safe so that we all can have good outcomes in any of our health situations, and particularly in our pregnancies. Babies do not wait for anybody. They will arrive when they arrive, and your care providers will have to be there whenever they are required. We just saw Dr. Jayashree. I mean, she hasn't even changed out. She's just delivered a baby, and we've seen just Dr. Adarsh go in because it's a planned surgical time. Where was I? I was on the other side with Dr. Amita. We were starting with. So what if people kind of find themselves with swellings, if not with a blood sugar level, with a swelling? What's the response going to be like?
Yeah. So most of the times when people say that they have swelling in their feet or swelling in their hands, usually it's a physiological swelling that happens. So we would always tell them that, okay, well, it could be a physiological swelling. And what you can do is you can legs while sleeping, put them on a pillow, and then you will see that the swelling would go back or minimally reduce, in the mornings when you get up. And over the evening, if it is increasing, then obviously it's a physiological swelling. But sometimes it may be because of some other medical conditions also. For example, they could be having a blood pressure associated with pregnancy, during pregnancy, and people get to know that it is a blood pressure there. So most of the times, patients generally have a BP instrument at home to monitor, so they can measure their BP at home and they can get back to us. And supposing if we need to call them, then we would call them. Additionally, we can also sometimes advise them to get a urine routine done to figure out if there is a urine albumin present, which again is significant if they are developing a preeclampsia or a pregnancy-induced hypertension. So these are the only conditions, but most of the times it is a physiological edema and they should not worry about it.
It's a physiological thing. If there is a little bit of swelling, it increases, it kind of goes away when you're sleeping with your legs raised up. In the morning, it's not quite there. In the later the parts of the day, you're seeing it. That should not be cause for worry. But is it possible, and this is where again I come back to the telehealth people, and for those that are practicing the distance medicine part of it, is it possible for people to get their blood pressures checked up at a distance or at the home level? And what's the reliability that we can, how do we kind of facilitate that? Again, the skill transfer that Dr. Hema started off with, is it something that we can enable people to do reliably at home? Dr. Payal.
At home, if the patient is well educated, they know how to use a digital BP apparatus. then definitely they can take their blood pressures and inform accordingly. But if the patient, like we have 60% of a population in the rural areas, they don't know BP, they don't know anything. So at this, if for such patients, we tell them to report to the nearest PHCs or CHCs. There we have paramedics who take the BP, and that is reliable. We have BP apparatus, we have ashas, we have workers who are taking reliable blood pressures, and we ourselves are telling them to take it in front of us, so any errors could be avoided. And if the patient is having a higher BP, and then we tell them to report to the center. And if the BP is normal, still their swelling is increasing, then we advise them accordingly that they have to come to the center alternatively or daily to record their blood pressures.
Ji, ji. So therefore, and this is where I would kind of probably also even switch to Hindi and say this, कि अगर सूजन है तो ये स्वाभाविक हो सकता है, ये नॉर्मल हो सकता है, लेकिन अगर ये बढ़ता ही रहता है या फिर अगर ये रात को सोने के बाद वो कम नहीं होता है, तो आपकी बीपी की जांच जरूर करवा लें घर के पास, या घर में अगर इंस्ट्रूमेंट हो या पड़ोस में जो हेल्थ केयर प्रोवाइडर हो, उनसे ये आपकी बीपी की जांच करा लें, और उससे हमें पता लग जाएगा कि अगर आपको आगे कोई और चेकअप करानी है.
And we
If you
tell
do
them
not,
to yes, and we have to tell them about other symptoms as well, like giddiness, nausea, vomiting, or
Sure,
blurring of
sure.
vision. If they are feeling such things, then they have to report to the
Ji,
center, because
ji,
that could be alarming.
ji. So therefore, the same way that we talked about the first trimester, a pain or a bleed is a problem. You need to go to your gynecologist or to the hospital. In the same way, anywhere down the line, if you have swelling that does not go down, if it's a very bad headache, or if you're losing, you can't see well, अगर ठीक से साफ दिखाई नहीं दे रहा है, सर दर्द ज्यादा हो रहा है, या फिर उल्टियां हो रही हैं जो कि थम नहीं रहे हैं, तो आपको डॉक्टर के पास जाना जरूरी हो जाता है. And that is something that will constitute an emergency. Diabetes may not be something that we can pick up, but this is something that we can and should be able to intervene in. Question that has come up. So my pregnancy is going on and I have been exposed to COVID. Is it possible for my baby to get COVID? My delivery is only another 2 months away. What's the chance that my baby is going to get COVID? Can I ask Dr. Jayashree and Dr. Alka to kind of answer that?
So if so anybody in this scenario can get COVID, because now there is definitely a community spread going on, and at one point or other all of us are going to be affected by COVID. So we should not live in this false illusion that once the lockdown is over, everything is going to be hale and hearty, and we are going to detach ourselves from COVID, right? So the only thing we are doing with this lockdown is we are trying to prevent everybody falling sick at the same time, right? But there is no need to panic. We have seen young people do well even if they are affected with COVID. If the delivery is 2 months late, I'm sure all the pregnant ladies have been sitting at home for the past 1 month, especially the ones who have been with antenatal care with us. So they are not really exposing themselves. So even if they get affected with COVID, we have already discussed this, and Dr. Alka had said in the initial go only, there is no vertical transmission per se that has been noted. So the baby getting COVID is out of the question as of now, till we get further research and we see more and more COVID patients delivering. But as we said, if somebody has COVID symptoms and it is mild, they should be practicing self-isolation, keep talking to their doctor, keep a watch on the movements of their baby, and go to an hospital if needed, if there are any serious symptoms, or if we see that after 2 weeks of isolation, they could get an ultrasound done to check that all is well with the baby. But the main thing is they should not panic. They should keep themselves reassured and sit at home quietly.
Dr. Alka? Your mic is off.
Said whatever needed to be said, but I would like to add, if she has suspected COVID, then if she has any symptoms like fever or respiratory problem, then she has to report very fast. As far as her baby is concerned, if she does, even if she has COVID and she doesn't deliver in next 2 to 3 weeks, then it will pass off. The baby, there is no intrauterine transmission, so there is no need to panic that the baby will be born COVID.
Right. Dr. Sandeep, I mean, there's a question here that I want to kind of direct to you. There is a requirement for an emergency C-section. Labor pain started off, and now there's a question of emergency C-section. The delivery is not going as per the plan. Is there something that either the patient or the baby is at risk for? And what would be your advice, and how would you kind of go ahead? This is a question that's coming in from the Facebook side.
So, is it you're talking about a scenario where the patient is COVID positive, or you're talking about any pregnant patient?
Any patient right now.
So, if any patient needs a cesarean section, the patient does not have a history of contact, no history of fever, no history of upper respiratory tract infections, then most probably the patient would not be a COVID positive patient. Right. So that is like a routine obstetrical how we manage the patients. But however, there can be asymptomatic carriers. So what the routine is nowadays is that we are putting on the PPEs, the protection equipment for all the cesarean sections, so that a patient who's an asymptomatic carrier may not transmit the infection to the anesthesia team and the surgical team, and also the pediatrician. So yes, the equipment, the protection equipment kit is being used for all the patients routinely for normal deliveries and cesarean sections.
Dr. Hema?
Yes, Bobby, I wanted to tell the viewers that, see, we as healthcare providers may be aware that all these protective equipment has to be owned, because that's part and parcel of the universal precautions that we take, presuming that unless proved otherwise, there may be a COVID suspect or a COVID positive. But the more important phase is after the C-section, when this patient is shifted to the ward, there only one relative to be allowed, and then the mother has to be masked and also maintain her hand hygiene while feeding the baby. And the staff, especially the housekeeping staff, should know the cleansing protocols with the 1% bleach solutions, how all the fomite have to be cleaned out every 2 to 3 hours, and how every staff has to also maintain a distance and not unnecessarily go too close to the patient to do a lot of routine things that they do in the post-operative period. So it is quote unquote very, very guarded, following of all the norms that has to carry on till she is discharged, because we feel as on today, even the transmission either from the patient to us or from us to the patient, both are a reality. So both need to be careful with the distancing and hand hygiene. This is what I meant by skill transfer. Everybody in the line, right from the consultant to the junior doctor to the staff nurse to the housekeeper to the office assistant, everybody should fall in line and visually showcase that this is being followed. That will be very reassuring for the patient and her family.
Thank you so much, both Dr. Sandeep and Dr. Hema. To answer your question, the person who asked on the Facebook side, I mean, whether a C-section was contraindicated, no, the C-section can go forward, and just be aware that the risk may not be to the baby or to you. It may be the other way around, to the anesthetist, to the pediatrician, to the care providing team that is taking care of you, because you may be positive, you may be asymptomatic. People don't know. And so therefore, the precautions that the team needs to take is much, much more in these times than before. And they are putting themselves constantly at risk. And so therefore, be mindful that if there are charges that come up for PPE equipment and things like that, there is conversation that hospitals may not have, and these are also expensive bits. Just be mindful that it could be just a little bit more expensive. Should we sort it out differently? Those are different conversations. That is not the scope of this current discussion. But just be mindful that your care providers are going to be putting themselves at risk, whether it's a normal delivery or whether it's a cesarean section. If it is a cesarean section, an operative procedure, then there are a lot many more people involved than just a normal delivery. And so therefore, just be mindful on that one. And so it's the same thing. I mean, while that's happening, this question has been already answered right in the beginning, where I had asked about breastfeeding. The questions come back again. No, Breast milk does not transmit COVID as far as we know right now. In fact, if the mother is not COVID positive, if there is no exposure before, then breastfeeding normally should go on. If the mother has been definitively diagnosed as COVID, then please follow the advice that your center, that your obstetrician, that your pediatrician, and the care team is providing you. Standardized guidelines on this one are yet to be uniformly adopted by everybody. So I would leave it to individual care providers to define that. And please talk. If you have a question, please do not hesitate to ask. And at this point, even though everybody's busy, asking is your best solution here. If I may turn back. Sorry. So if I may turn back, we have taken care of the risks. There's diabetes, which can be picked up. There is the swelling or the chances of an elevated blood pressure and heading towards emergencies in that side. Somebody has asked this question. If we don't meet our obstetrician, if I stay back, I'm just going to read this out straight away. A lady is asking, I always worry that when we ask to be stayed back and not visit unless there's a problem, and for any reason unexpected intrauterine death occurs, will the doctor be blamed? Is the question. And this is a very difficult one. And I don't know who to kind of direct this question. Whoever wants to kind of take this first. Dr. Hema, your fingers goes up first. So let me start with you. And I think I want to hear from each of you on this.
Yeah. See, that is why we always tell them, while we say that don't unnecessarily come to the hospital, it does not mean that if you're anxious and you can get in touch with your doctor on the telephone, that you should not strike a conversation with her. If you have something untoward happening, she may just as well say, okay, this is your extra visit, but come along because I want to see you and I want to examine this, that, and the other. But advanced pregnancies, usually, as Dr. Adarsh already said about the child's movements, we tell that even in the non-COVID era, the victim and the advice to the patient was the same, that please keep a fetal kick count or the child's movement count. So that is something that if she's even slightly doubtful, she must first of all bring it to the notice of her doctor. And again, it will be a scheduled appointment, which is a staggered appointment as on today, because we don't want mixing and crowding in the hospitals, and should be seen as quickly as possible in the manner that it has to be seen, and then check it out whether the child is really in trouble or not. So there are ways to get around it, because ultimately, either you blame the doctor or we blame the patient that she did not come on time. If the outcome is bad, it is bad and sad for everybody concerned. We don't want these things to happen. So it is better sometimes to overreact and rather visit at least get in touch with your healthcare provider than saying that, no, it's okay. They've said it's okay. Sometimes it may not be okay, so you need to just consult with your doctor first thing, because that is no harm in any case. And then if he asks you to come over, yes, I think you should, because ultimately, just because of a lack of a visit or the visits being far few between, definitely both the doctor and the patients are anxious, because this is not the way we are used to seeing our patients. We are used to seeing them at fairly regular frequency to reassure her and reassure ourselves that all is well. So this is a changed circumstances. So please be compliant with your complaints and the visits, which are to be tailor-made as per whatever the situation is. Yeah?
Dr. Alka.
Doctors are humans, not gods. Nobody can guarantee 100% outcome even in non-COVID situations. And to my mind, this is a very good experiment going on. We will see, we keep telling patients, there is an emotional bond, there is so much of bonding when they come to show us. Now this experiment is going on, we are only on telemedicine. So let us see what is the effect on antenatal outcome later. I'm sure it has to be little more guarded, because the close, there are many visits. Otherwise, what is the fun of teaching for decades? Good antenatal care, timely visit, 10-12 visits. Having said that, keeping a daily fetal movement count, if they are high risk, then need not be unnecessary complacent. They must visit, because many times you need to terminate pregnancy. They have placenta previa, they have all these issues, they have pain in abdomen, accidental hemorrhage. So picking up those things in these COVID times may be little difficult. And as far as IUD is concerned, so we have to give proper advice, fetal movement score, taking out, filtering very high risk patients, calling them. Not that everybody can be, treated on telemedicine. And then ultimately, I always say doctors are humans, not gods. Adverse outcome cannot be guaranteed.
Right, Dr. Jayashree. Can't hear you, ma'am. Yes.
So I fully agree with Dr. Alka. Even there shouldn't be no blame game at any point in time, especially in not such circumstances. And when we do telemedicine conversation with patients, we always tell them we are available in hospital. You can see. So some of the consultations we do from hospital itself, so that they are reassured that when they need the doctor, their doctor is available for them. But it is for their safety and for our safety, and to keep the environment safe for their children to be born, we are restricting the movement. And I don't think at this point in time we should be worrying about the blame game. And even in non-COVID times, we do have intrauterine deaths, right, irrespective of the best monitoring. So I think the fetal movement count should be the best judge. And obviously the high risk patients do need to come back to the hospital, and we do call them for their fetal medicine scans also, where they need growth monitoring, or if they have intrahepatic cholestasis or other problems. So usually such things don't happen, and if they happen, they can happen in non-COVID times, even in the best of 10 to 12 visits and care.
Right, Dr. Amita.
So, adding to what all of them have said, I would say that one important thing I think we should be teaching our patients is, they have to monitor themselves. Besides the fetal movement, I would like to educate my patients about their fundal height. Not doing if you in the villages, how do they get to know whether they are progressing? Most of the times they are going to doctors or care providers. So just keep, it's growing or not, and that is what can tell them that an assessment as to whether your abdomen is growing or not. That is the uterus or the fundal height is growing or not. And if it is, that means the pregnancy is going well. And obviously, like she said, that intrauterine deaths can happen during non-COVID times, which is quite unexpected, and it may happen during these times also, where we cannot blame each other as to who was at fault. The only thing is easy accessibility to the patients, which we are providing. And obviously, in hospitals, we have availability of doctors 24/7, where if the patients are panicking, then they must definitely reach the hospital, come what may, and get. So knowledge of is important.
Right, we are losing you there, Dr. Amita. Let me ask Dr. Sandeep. I mean, on the same thing, what's your feeling?
See, if a patient has an IUD, it's emotionally very sad for the patient and the care provider also. So I would rather tell the patient to be very careful about their feet.
We seem to have lost Dr. Sandeep too. I mean, there was a reason why I was keeping Dr. Payal last, because it's been alluded before too. One is how do you kind of encourage people to monitor their daily fetal movement?
Yes.
And the second is what Dr. Amita said, how do you enable people to know whether their fundal height or the baby is growing? Is that something that is possible at a telehealth, or how do you transfer that skill to a home level? And that's what something I want to kind of understand from you.
Yes, first of all, we have to understand that telemedicine cannot replace our actual examinations and our actual visits. This is telemedicine. What Apollo has started was for remote people who do not have access to hospitals. But in this scenario, we are not there to blame anybody. We want less visits, but we are not saying no visits. Less visits, but you have to monitor yourself during our interaction with the patient. We check for the weight gain in the pregnant patients, whether they are gaining weight or they are not gaining weight. Secondly, we are training our paramedics to see for the fundal height, whether the fundal height is increasing or not increasing. And third, the most important thing for an educated or for a remote or for a rural patient is daily fetal movement count. That they have to see. They have to monitor themselves for the fetal count. And if they think it is the baby is not moving, or if they are anxious, they can anytime they can call the doctor. The advantage of telemedicine is they can call at any time, 24/7. You have your doctor available, and if you think you have to visit a doctor, definitely nobody will say no why you have come to the hospital. It is only for your good that you are being asked to stay at home. So definitely, if you have a high risk pregnancy and if you think you have to visit a doctor, nobody will say no. The visits are being done less, but no visits are not being advised to the patient.
Fair enough. I just want to kind of go back to where Dr. Alka started off this conversation, which is doctors are as human as everybody else. They have been trained, they have put themselves through enormous amounts of hard hours of training to be able to provide a standard of care. However, human beings are not machines or programmed cycles. There's always the likelihood that something or the other might not go according to our plans or according to our wish. And if it does not, then it is not an occasion to take out your disappointment and your anger. Dr. Alka, your line is to be muted. Sorry, thank you so much. If something does go wrong, unfortunately, God forbid, then the person, you should not take out your disappointment and your anger onto the people that have been walking with you for the longest. And that is something that I and we at ISW are always worried and cognizant about. We see increasing numbers of incidents around the country when what was supposed to be a happy outcome did not turn out to be as happy as you had imagined. Those are not times when you express your anger at the people who have walked with you. In fact, there may be somebody who will need their help at the time that you are getting angry with them. So please do not block their time. Please do not obstruct their regular working. They will make the time. I mean, I've been a clinician too, and I know that when something hasn't gone right, I have it as my obligation, as our experts, as any clinician has as their obligation. They need to come back and talk to their patient and the family. They will do so, because it's not that they are machines or they are robots or they are unconcerned people. The challenge of increased workload is such that they may need to move on. Be mindful. Be careful that you do not load them with any more than they need to. This is where my appeal to the hospitals is. Please provide, if you can, more counselors who can work with your clinicians. It cannot be just the clinicians alone who talk to the families, especially when things are not going easy. And that is something that we need to take as a lesson as we go forward. The more the number of people that we have to share our difficult situations with, the easier it might be to handle the outcomes and the disappointments as we go forward. And that's something that I want to kind of reassert, particularly because the cycle of births will continue to happen. We will, whether we like it or not. And this is not about liking or disliking. We all want to see babies and pregnancies happen and in a happy way. And so therefore, this is something that we should be extremely careful and mindful about. We are about 8 minutes away from our 90-minute close time. Is there something? I'm mindful that most of the experts that we have today are people who are in large institutions. But most of our babies do not get born in large institutions. They are born in the periphery. They are born in situations where a trained obstetrician may not be available or a neonatologist may not be available. In that kind of a situation, particularly with COVID, is there something that each of you has by way of encouragement and advice for those that are both pregnant and those that are in the service provision area or they are in the community? is there something that you want to say? And may I start with Dr. Alka?
Sorry, I didn't get your question. Can you repeat in short, please?
As a lot of the babies that are going to be born in India are not going to be born in the fortresses, in the Columbia Asias, in the Parasis, in the Madhukar hospitals. They will be born nearer to the primary care center. They will be born in very different circumstances. Each of those babies is precious. Is there a message that you have for the DIs, for the trained midwifery people, for the frontline workers, or the family and community in these particular times? And I want to hear from each of you.
The frontline workers have to be very careful and have high index of suspicion for COVID. So they should take history from every pregnant patient of the contact, of the travel, of the sickness, whether there is any fever, and any patient who is suspected like fever and respiratory symptoms, they should immediately report so that if suspected COVID, they should be diagnosed early, and whatever care is available, see, it has to be provided to them. But I would like to take this opportunity and send a message. Time and on, India has developed so much, but our health services in periphery, we all know, are disproportionate in the development. This time, after this ugly episode is over, government should really take a serious note of our health services in the periphery, because we all agree that it is so much less than ideal that if COVID goes in periphery, it will be very difficult, because we hardly have any good infrastructure and available manpower. So we should take lesson from this episode and try to improve and strengthen what you are talking of the people in that area, because they are always underprivileged, and in this COVID time, it is further pressure on them. So whatever at present whatever we can do, we should, but at least in future, we should take a serious note of improving our health services in the periphery.
Dr. Amita. Your message or your advice to those that are at the front lines, away from the cities, in smaller centers. Dr. Sandeep?
People who are in the front line at the smaller centers, first and foremost, I'd like to tell them that they, as Dr. Alka said, they should take proper history of the patient. And if they suspect the patient to be COVID positive, it is better to send the patient to a higher center, because such patients could start developing respiratory difficulties even in second stage of labor, and it would be difficult for them to manage. But in case they feel the patient is totally asymptomatic and there is very less possibility of the patient being COVID positive, then they, with proper hand hygiene, with proper sanitation, wearing gloves, using masks to, the patient should use the mask, the relatives should use, as minimum as possible, relatives around the area, the frontline health provider should be using a mask. They, if possible, they should be wearing a protection equipment if possible. If not possible, then at least they should change their clothes immediately after the delivery, and they should be taking proper care. And hand wash, hygiene, sanitizers, these are things they should be using. And especially when the patient is nearing second stage, when she's pushing, there's a lot of possibility that an asymptomatic carrier may disperse the infection. So a mask to the patient health providers is a must, and there should be minimum relatives possible.
Right, Dr. Jayashree?
I would say that proper teaching and emotional support to the caregivers in remote places. We are much privileged to be living in the city. We have the hospital accepting our demands for PPE and rotating our duties. But I think it is the healthcare workers, and I salute them all, the ones who are working in the peripheries, who might be touching these patients, who should be given adequate emotional support along with materialistic support to take care of all pregnant women. But like it is the birthright of every woman to deliver safely, it is also the birthright of every healthcare worker to be safe in this scenario, because we have seen what has happened in it and we don't want that to be happening. I mean, that should be our motto, and all of us healthcare providers should be able to support them in whatever way possible, also if it can be done in any way.
Right. Dr. Payal?
Yes, for healthcare workers, I suggest they are the most vulnerable population because they don't know whom they are treating and whom they are going to provide their services if the patient is positive for COVID or negative for COVID. So proper history, proper PPE equipments, whatever necessary. And if they feel the patient is COVID-19, if they are suspecting, they should preferably refer them to the higher center because it is very difficult if she will develop respiratory difficulties, they won't be able to manage it. And the most important thing in rural centers is this: least number of visitors should be allowed, least, so that there is least exposure.
Right. Thank you so much. I kind of bring the cycle back to where we started off with, and I want to go back to artists. How do you transfer skills from very resourced centers to the periphery where everything is at a premium or at a shortage? Normally, as Dr. Alka said, I mean, and that should not be, and this should be a lesson, or this should be a watershed moment where we say, no, our periphery deserves as much resources as the urban centers. As a transition, how do you get this transfer done?
Thank you, Bobby. Thank you so much for asking me that question. A whole circle round, as you have said. Okay, it is our endeavor to see that every single one of those 30 million women who deliver every year in India should be having an access to delivery with quality, safety, dignity, and respect. And for this, just 35,000 OBGYNs are not going to be enough. The numbers don't match. So we need to necessarily bring in all the frontline healthcare providers, and it's my crazy dream to train 1 million healthcare providers, shift the tasks, transfer the skills so that all that they can handle with the same phenomena of the quality and the skills should be percolated through them to every nook and corner. It is that we are walking the talk because through our organization, through this very digital platform, we have trained hundreds and thousands of frontline healthcare workers who are the teams in various private hospitals, which have enrolled for a quality care program within our parent organization, Foxy. It's called Manyata. There are 16 standards of delivery which they have to meticulously follow, and with or without the presence of the specialist OBGYN, who are really required only for the high-risk cases and also for special circumstances like COVID. So when it comes to delivery as a matter of human right, one compartment is safe delivery, which is our bottom line. The other compartment now is how do you handle the high risks in this high risk time of COVID, and how do you actually handle the COVID suspect and the COVID positive. So these have to merge into a commonality of the standard of care that is our responsibility to see to it that in a vision of universal healthcare, this is the least we should make it accessible to every single woman who is delivering in our country. So there is there is an evidence that we have walked the talk, because this program is already on since the last 6 years or so, and more centers are enrolling into this. In fact, we are now embarking on a special program of what is it extra that they need to do in times of the COVID crisis, how they make the hospital COVID friendly, how each one of them will learn newer tasks. And I'm very, very delighted to share with you that this is not rocket science. The human rich resources available to us is just our intent of guiding them to do the right things at the right time. And I think this dream, with the cooperation of everybody here, should become a reality for all times to come.
Right. So there is a need to understand how we can take the standard of care that is available in each of your hospitals to the periphery, because, and I want to kind of put on my public health hat now here, we are talking about 25 million children, give, take, 2.5 to 2.6 crore children that get born in this country every year. That's more than the population of Australia.
Yes.
That is not all the pregnancies that take place in the country. The number of pregnancies are higher than that. We have probably closer to 4 crore pregnancies, of which only we get about 2.6 crore children being born. Those are not happy outcomes for at least 1 to 1.5 crore women and families. We need to be mindful of that. Our conversation has been around those that progress to pregnancy and to a live birth. But let's be mindful that there are significant numbers of false starts or not so happy endings. And those need to be both addressed and taken care of. And that requires sometimes more skill than the normal course of a human pregnancy. And that's where we need to be more attentive. Related to that is also the question that not all pregnancies are timed or desired at that moment. And so there needs to be a wider, more nuanced conversation around how couples can plan on embarking on a pregnancy. Unfortunately, despite all the conversations around making available tools for planning and looking at timing their pregnancies, a large number of people still are unable to access the services or the products that they require at the time that they need it. And that is also as critical as ensuring that a pregnancy that is desired or has started off ends where it is expected to, which is a healthy baby and a healthy mother. A healthy mother is the birthright of every child. A healthy baby is the right of every pregnant woman and couple. And a healthy set of healthcare workers is the right of every patient. Because if you have healthcare workers who are not at the peak of their health and are able to deliver you the services that they are trained for, then you get suboptimal services. On our part from IHW Council, it's been a privilege for the last 90 minutes to walk you through, along with our esteemed panelists, Dr. Alka Kriplani, Dr. Jayashree Sundar, Dr. Hema Divakar, Dr. Payal Raghuvanshi, Dr. Amita Shah, Dr. Sandeep Chadda, and for a brief while, we had Dr. Adarsh Bhargav, walk us through different aspects of this exciting time in human life, the human pregnancy. This is where I may misappropriate this term, but every baby that's born in this country is a Bharat Ratna for that mother. We need to ensure that we get the appropriate care delivered to each of these Ratnas as they come out. Thank you for your questions. May I remind you once again the top line things that have been said. No panic. Ensure that you minimize risk by not being in crowded situations. Wash hands frequently. If you find yourself during your course of pregnancy, either with extreme pain or with an unnatural bleed or with a swelling that does not go away, you should seek out care. Those are not normal. For everything else, take a chill pill. Do not rely on all the things that come on WhatsApp. And I keep on saying that irrespective of my audience, bad information is injurious to health, and you should be mindful of what you're getting. Thank you so much for being with us. If you have questions, please ask. And I want to close with this last thing that Dr. Alka said. We should come out of this with a renewed, strengthened healthcare system that delivers the same care, irrespective of where you find yourself, whether in a city or in a village. Thank you so much on behalf of the IHW Council for being part of this conversation. Thank you very much to our esteemed panelists. It was such a privilege to have you share your experiences and time with us. Have a good evening.